Hi everybody, I'm Dr. Jen the Acupuncturist, and this is the first in a series of videos I'll be making explaining and talking about holistic medicine, the benefits, some of the therapies, and particularly how it can benefit children with special needs. In this first video, I'm going to be going over some basic definitions of what alternative, holistic, and complementary medicines are, and then I'll be listing and talking about just a few of the therapies lightly because I'll be making in-depth videos further on. So I'm going to start with alternative. And what is alternative medicine? Alternative medicine generally refers to any medicine that is not within the scope of allopathic medicine. It's not what you go to the doctor for. It's not something your MD or your PT does. It's the alternative, the other option. Holistic medicine also emphasizes education and personal responsibility. So this means it's my duty to make sure that you have the information, as much of and the best kind of information, so that you can make the right decisions. It's not up to me to make your healthcare decisions. It's up to me to give you choices and options and get you informed and educated, and then it's up to you to make those best decisions. I can do the acupuncture, but I can't decide what you're eating at home. I can't decide when you're going to sleep. So it's super important that you be an active participant in your own healthcare. Health isn't something that should be done to you. It's something you should do for yourself. The word alternative, however, gives the idea that this medicine is in place of or of lesser value than Western medicine. And that really isn't the case. So most practitioners like to use words like holistic or complementary. So what is holistic medicine? First of all, it's whole medicine. So you are not just a cramp in your calf. You are not just poor digestion. You are not just ADHD. We're going to look at all of those combined, all of the symptoms, including things that seem unrelated. So if you're coming in for a tummy ache, we're going to ask about digestion and how you're sleeping and whether you're having pain in other parts of your body, because you're an entire system, and that's how a holistic practitioner sees you. They're going to consider everything from your nutrition to your lifestyle to your spirituality to your emotional aspects, along with the physical aspect of what's going on. Complementary medicine refers to going along with instead of replacing. So it's a better term than alternative because it implies that we want to work with your medical doctors, we want to work with your occupational therapist, your physical therapist, your massage therapist, because again, the bigger the team, the better the results. So we want to go in line, and it's super important. For example, if you're seeing an herbalist or you're seeing an acupuncturist that works with herbs, or you're seeing somebody who's getting you supplements or vitamins, it is super important that they know what medications you're on and the interaction with those herbs. It's very, very important. So the more communication, the more information that gets shared between your therapist and your doctors, the better off you're going to be. So what are some of these holistic and complementary therapies? Well, I'm going to start with acupuncture because I'm an acupuncturist. And I want to start by saying it's not how you see it in the comics, it's not how you see it in the scary movies, and it's not how you see it in the commercials. You are not laying there with an excessive amount of needles for an extended period of time. First of all, the needles are so very thin. I'm going to show you one here. I have two here. As you can see, they're in a package, so they're sterile. They're not reusable. Well, I guess they could be, but we don't do that. And they're very thin. So most of them are about the thickness of 2 human hairs. I'm opening this one. I don't know if it'll get blurry if I get too close, but this is one brand that I use. This is a guide tube. This just makes sure that the needle is protected, and it helps make sure for some acupuncturists that it's going right into the exact spot. I'm going to pop this one out, and I'm going to see it's very thin, and I'm going to show you. It's so thin I can bend the needle For the most part, you don't even feel the needles. What you feel after the needles have been inserted is an overall sense of well-being, a sense of relaxation, a sense of calm. Some people get sleepy and they fall asleep on the acupuncture table or the massage table. Other people meditate. It's just a really wonderful experience. Depending on your acupuncturist and the style of acupuncture that they practice, because there are a variety of styles. There's traditional Chinese medicine, there's classical Chinese medicine, there's Korean hand acupuncture, there's auricular acupuncture, there's a French version of that, there's Japanese style. I'm not sure if I mentioned that, but there are so many different, and it's not just a style, it generally is a theory too. So there's a reason why they practice differently. It's not random, it's not just pulled out of the air. There's always a theory behind the way that we're treating the patient. It's not made up in our heads. For some people who can't retain the needles, there are different styles. For example, Japanese doesn't retain the needles. You can do an insertion, a quick stimulation, and then pull the needle back out. And what that means is, so I will place the needle into the point, give it a little twist, and then remove it right out. When people can retain the needles, you retain them about 30 to 45 minutes. You just kind of relax or meditate, as I previously stated. Now, for small children and children with special needs, it might be difficult for them to hold still for 30 to 45 minutes, or they may just be too sensitive to retain the needles. So, as I said, you can do an insertion and a stimulation and a remove, or you can acupuncture other parts of the body that allow the children to be a little bit more fidgety or physical or engage in something else because they're incapable of sitting for that long. And it's expected, they're children. So we have things that we can do, like specifically scalp acupuncture, which works on its own, again, its own theory system. It's not necessarily following the traditional meridians that people who practice traditional Chinese medicine follow. It works really well because the kids can move and they don't have to be stressed about whether they're going to be pinched in the movement of the needle. Or auricular, which means done completely in the ear. And those are two really good alternatives. Alternative forms of acupuncture for kids that either can't sit still or they're too sensitive, and it works really well for people who are too weak to receive too much acupuncture, so people with weakened immune systems or who've been chronically ill for an extended period of time or in extreme amounts of pain just all over their body, for like fibromyalgia. Using these alternatives works really well to get them to a place where they can tolerate more body acupuncture, if that's even necessary. Acupressure works on the same points with most of the same theories as acupuncture, but instead of using the needle, we're going to use our thumb and we're going to apply pressure. We may use the elbow if it's a larger muscle, like if it's in your back or if it's in your glute or on your thigh and the trigger point is larger, we may use an elbow. Mostly it's your thumb, or a knuckle works really well to alleviate some of those points to stimulate it. I find that with young children or children who are very sensitive to touch, doing it with just the outer edge of my thumb to create that. What we're looking for with acupressure is a pinkness, a redness to the skin, showing that we've gotten more circulation and increased blood flow in that area. So, as well as trying to relieve trigger point. So there's two functions to it. And I find that with doing it on small children, just using the outer edge or the outer edge of your thumb and rubbing it on that area quickly, or not too rough. You want to do it rough enough to get the circulation there, but you don't want to bruise them. But it works really, really well, and because it's done one at a time, it allows children to get used to touch or to reach a point where they say, okay, I've had enough, I can't do anymore. Another really great alternative to acupuncture and acupressure is Electro Acupressure. And I do this with what is called a dolphin machine. So these are my dolphin machines. Sometimes I use one, sometimes I use two. And it doesn't puncture, so it's just, the tip is kind of like a pen. And you turn them on, and it sends current from one point over to the other. It's a really light, gentle current. Some people don't feel it. Some people feel it like a light tapping just under the skin. And other people feel it like like a radiating, it's hard to describe, just a radiating sensation. But none of these are painful, none of these are overstimulating. And again, if it becomes too much to tolerate, we can either move to another area or move into another therapy. These, however, are really, really great for children because it gives me an opportunity to give them one and show them how to use it, and use one myself, and then we can go over their points and they actually start to use their points. They learn their points, and it makes them an active participant, and it gives them some control over their own therapies and their own healthcare, which a lot of times children who are sick, chronically ill, or who have special needs, healthcare is something that's done to them. Mom gives them the medicine, mom makes the decision, the doctor says this, the therapist says that. This gives them a real opportunity to feel like they're a participant, to have a little bit of control over what's going on in their bodies. Another holistic therapy that I really like to use, especially on children, is cupping. Now, cupping, when most people think of it, they think of the glass cups in the fire. I personally use an alternative. I like the silicone cups, specifically because there's no fire and it works really well on children. Sometimes when you light the alcohol to put the cup on the child, they're really uncomfortable with the fire. So I find that doing this, using these and eliminating the fire, really makes it more comfortable for them. And again, using the silicone cups in the really small sizes gives them an opportunity to participate. So I teach them how to cup, how to apply the cup, where it's supposed to go, and then we have fun with it. I've seen children make faces on their bellies with cups. They like to do it on mom's forehead for a second. I mean, it really, again, it just eases some of the tension for children who have been to the doctor really frequently, and it can be overwhelming for them, and it gives them a little bit of control of what's going on in their healthcare. And it's simple enough for them to actually understand what it's doing for them and knowing whether it's working for them. They know if they feel better or not, and after they've had a cupping session or they've had their little acupressure, they're very honest with telling you, I feel better or I don't feel better. This is making me feel better, or I don't want this anymore. So what I like about cupping, you may have seen some of the athletes from the Olympics with the circular marks on their back. It's really, really great for relaxing the muscles. So children who are walking on their tippy toes, this is a really, really, really great way. The cupping and Tui Knot or massage, and Tui Knot is Chinese medical massage. So it's not an all over Swedish body massage. It targets a very specific body part. But massage, Tui Knot, and cupping are really great therapies for children who walk on their tiptoes, who are experiencing a lot of cramping, who may have chronic pain. But it's also really great to help kids calm down, to help them relax, to relieve their day-to-day stress from the things that they're having to face in school or just anywhere that they're going. And it's wonderful for things like congestion from allergies or asthma, or having bronchitis or getting a chest cold. It's really, really great for helping push that right out of the system. Another therapy in holistic medicine, or that falls under holistic medicine, would be herbal therapies. So things like teas, essential oils, herbal supplements, those are all really, really good therapies. But I cannot state enough how important it is to find a qualified herbalist. You can't just do it yourself. You can't just presume to know. You can't just do it because your neighbor tried it. Definitely find somebody who is qualified to work with herbs. And this is so important because, especially if you're taking medication on a regular basis, it is so important, so important that you see somebody who understands the interactions between the herbs that you're going to take and the medications that you're currently on. It's very important. And it's extra important mostly because when you go see your MD or you go see your pharmacist, they don't study a lot of herbs, they don't study a lot of alternative medicine, so they don't have a good concept of herb-drug interactions. Acupuncturists, I can't speak to other programs. I would like to assume that people who are studying specifically herbalism are also taught these types of pharmacology, but acupuncturists in most cases are taught the importance of learning the difference between, or excuse me, the interactions between the herbs that we're going to use, that we want you to use, that we're going to give you, and medications that you might be on or you may have been on for many years, blood pressure medications, depression, antidepressants, any of those kinds, steroids for asthma. It's important for us to know that, and it's important for us to know the drug interaction. So should you choose an herbal to go with an herbal therapy, it's important to find yourself a qualified herbal therapist. That being said, herbs are amazing. They're amazing. You can incorporate them into your food by cooking them into your dinners and your meals. You can also use essential oils, which are the oils from the herbs that generally an herbalist or an acupuncturist would prescribe to you. An acupuncturist and herbalist may recommend pills. They may recommend dry herbs. They may recommend powdered herbs. They may recommend tinctures. It's really going to be what you're willing to take, because they all taste different. They all require different amounts of effort. So if you're given raw herbs, you may have to cook them, you may have to steep them into a tea, you may have to turn them into a soup. Whereas if you're given a tablet, you can just take that 2 or 3 times a day. As I was saying previously, there are herbal therapies that can replace things like Xanax, so that you're not having to take a Xanax, you're not having that loopy feeling, but you're still getting that calm sensation. The beauty of herbal therapies is that most of the time they have very few side effects, if any, and they're usually temporary. So you're not just going to be on these pills or this soup or this tincture for the rest of your life. The goal is to correct the root problem. That's the heart of everything holistic, alternative, complementary. So if we can solve why you have anxiety, you won't have to treat the anxiety, because you won't have the anxiety. We'll have treated that. Another great alternative are pain meds. There are some really, really great herbs that will alleviate pain. They're non-opioid, non-habit forming, and again, they won't have the same side effects that other medicines have. And then you can use herbs for lighter things like the common cold, a flu. There are herbs and oils that you can use in place of having to take more medication. And this is really good for people who are, like I said previously, on medication, because do you really want to take more pills? Do you really want to have to take more medicine? If you can drink a tea, or you can rub an oil on your belly or on your back and really alleviate some of those symptoms, or do some cupping, then why not do that instead of adding another medication to your system? And like I said, when you're treating the cold with your NyQuils and your DayQuils, you're not really boosting the immune system, you're just treating the symptoms. So when you're doing it with teas and herbal supplements, you're boosting the immune system, you're strengthening your body so that the next time around, you're less likely to catch it and your body can fight off what you're fighting now. Vedic Medicine is another holistic medicine. It's one of the oldest systems of medicine in the world. It originated in India. It's still incorporated as a part of their traditional medicine currently. And it has its own, much like Chinese medicine where you have traditional and classical and I guess it's not Chinese medicine if it's Japanese style acupuncture. But much like those where they're whole systems, Ayurvedic is a whole system. So it incorporates its own style of massages, its own set of herbs, and its own formulas and its own theories. And it's a wonderful system of medicine. But again, if you're interested in Ayurvedic medicine, make sure that you find a qualified practitioner. I cannot express this enough. It's so important that you find somebody who knows what they're doing and not, well, I saw it on YouTube. Not that YouTube is bad, but it requires a lot more education. It's not that simple. Or your neighbor tried it, or your grandmother's friend's cousin had the same issue and this really worked for her. That's not an effective system. The last therapy that I'd like to go over is hands-off energy healing. So these would be systems like Reiki and Body Talk. And these are done with energy, and the same energy that we would be accessing with acupuncture or with massage, you can access it with a hands-off approach. And this works really, really well for people who are unsure, especially children who have sensory disorders, who maybe don't like to be touched too much, who can maybe only tolerate small amounts of touching. This is definitely doing Reiki, doing it from a distance is definitely a way to allow them to, first of all, get comfortable. And because these children are so sensitive, they can actually feel what you're doing even though your hands are not on them. So it's really great therapy. And like I stated, with the other therapies that are good for children, they're also good for people with really weak immune systems and just with a weak physical constitution, maybe somebody who is aged and chronically ill, who can't really tolerate a lot of needles, who maybe is too sensitive for the Electro Acupressure. Reiki is definitely a good supplement. It's definitely a good way to build up to and strengthen them so that they can handle a more intense therapy. So these are just a few therapies and systems that are incredibly beneficial when added to your current health practice. Many of the times these systems find ways to help people and problems that traditional medicine can't. I can't count how many times I have been somebody's last resort. They had tried everything else, they have been everywhere else, they have asked everyone else, and they end up at the acupuncturist's office. And adding acupuncture to the things that they're doing, changing some of their lifestyle choices so they're more active, makes a world of difference. It makes a world of difference in how you view yourself, your individual being, your person, and it makes a difference in your actual healthcare, in your physical well-being, in your mental well-being, in your emotional well-being. So that's it for my introduction video, and I'd like to thank you for joining me. If you found this intro video interesting enough to seek out more information, please subscribe, like, or comment on this page, and please like my Facebook page at The Healing Well, and follow me on Twitter at Healing Well Acu. I'll put links in the description. Have a wonderful day.